When a woman attends clinic for gynecological problems or routine tests like the Pap smear, it provides a unique opportunity for screening these women. In this video, we will discuss the various screening tests and their indications. Pap smear for cervical cancer. This is the most common test performed for women who are ever sexually active. The Pap smear test is covered in a separate video. Please pause and click on this link to get to the video on Pap smear screening and its indications. Breast cancer is the most common cancer in women in Singapore. The risk factors of breast cancer include having a family history of breast cancer in a first-degree relative, BRCA1 and 2 genes, history of malignant or benign breast disease, history of ovarian cancers, early onset of menstruation, late menopause, having first completed pregnancy after the age of 30, nulliparity, hormone replacement therapy, for example, estrogen and progesterone therapy, and weight gain, especially after menopause. The most widely used breast cancer risk prediction tool is the Breast Cancer Risk Assessment Tool, also called the Gail model. Regular mammography and breast self-examination are the two recommended screening tests to be done from age 30 onwards. For women above 50 years old, breast cancer screening should be done every 2 years. For women between 40 to 49 years old, annual screening is recommended as younger women have faster growing cancers. However, the sensitivity of mammography is lower in younger women. For women below 40 years of age, there is no need for women in this age group to go for screening unless in the high-risk group. Women with germline mutations account for 5% of all breast cancers, with the most common mutations being the BRCA1 and BRCA2. Testing for mutations may be offered to patients who have clustering of breast, ovarian or colonic cancers in their families. Women should be referred for appropriate counseling to consider options for reducing risk and intensified surveillance. The main drawback of mammograms is that they aren't perfect. Normal breast tissue can hide a breast cancer so that it doesn't show up on the mammogram. This is called a false negative. And mammography can identify an abnormality that looks like a cancer but turns out to be normal. This is also called a false positive. A false positive means more tests and follow-up visits, which can be stressful and worrying. To overcome these limitations, women also need to practice regular breast self-examination and get regular breast examinations by an experienced healthcare professional. Osteoporosis is a progressive systemic skeletal disease characterized by reduced bone density or bone mass, which can lead to fragility fractures. Bone mineral density at the hip or lumbar spine, which is equal or less than 2.5 standard deviations below the mean bone marrow density of a young adult reference population, indicates osteoporosis. Early diagnosis of low bone mass can encourage modification of associated lifestyle habits that are associated with increased risk for osteoporosis. Such risk factors include smoking, heavy alcohol consumption, and a sedentary lifestyle. Modifying these habits can help initiate timely and appropriate treatment, which can then prevent any sequelae associated with osteoporotic fractures. Risk factors for osteoporosis and fractures can be classified into 3 groups: non-modifiable, potentially modifiable, and secondary osteoporosis. Non-modifiable risk factors include a personal history of previous fragility fracture as an adult, height loss of more than 2 centimeters over 3 years, history of fracture in a first-degree relative, especially maternal relatives, low body weight, For example, body mass index less than 19 and increasing age. The following risk factors may be potentially modified, including lack of regular physical exercise, prolonged immobilization, current cigarette smoking, alcohol abuse, and low calcium intake of less than 500 milligrams per day. Risk factors of secondary osteoporosis include drugs such as long-term use of corticosteroids, anticonvulsants, ongoing disease conditions, for example, hypogonadism, anorexia nervosa, hyperthyroidism, hyperparathyroidism, Cushing's syndrome, chronic obstructive airways disease, liver disease, malabsorption, chronic renal failure, rheumatoid arthritis, organ transplantation, and early natural or surgical menopause before age 45 years. Multiple patient and environmental factors may increase the risk of falls and fractures in women. Having had previous falls in the past year, impaired eyesight, medications such as sedatives, antihistamines and antihypertensives, gait abnormality, reduced muscle strength and balance due to aging or lack of exercise are some of the patient factors. Environmental factors include slippery floors, obstacles on the floor, inadequate lighting, and inappropriate footwear. While it is not recommended to screen the general population at normal risk for bone mineral density, the Osteoporosis Self-Assessment Tool for Asians, OSTA, is a simple tool based on age and weight that can be used in the assessment of postmenopausal Asian women. This tool categorizes women into high, moderate, and low risk of being diagnosed with osteoporosis on subsequent bone mineral density (BMD) measurement. The table here shows the suggested action based on osteoporosis risk from the Osteoporosis Self-Assessment Tool for Asians. For women diagnosed with osteoporosis, the bone mineral density should be measured once a year. The frequency of repeat bone mineral density tests varies from 1 to 5 years, depending on the severity of osteopenia. The test can be done once in every 5 years if the bone mass is normal. There are other ways to assess fracture risk. The Fracture Risk Assessment Tool is a simple tool that incorporates the risks associated with clinical factors as well as bone mineral density at the femoral neck for each individual patient. The algorithms give the 10-year probability of hip or major osteoporotic fracture. Bone mineral density is a measurement which assesses the fracture risk. The most common method is the dual energy X-ray absorptiometry, or DEXA. Hip and spine measurements are obtained and reported as T and Z scores. The result is expressed as the number of standard deviations from the mean. Further investigations can be considered to identify underlying diseases that can cause secondary osteoporosis. These include testing the erythrocyte sedimentation rate, full blood count, thyroid panel, renal panel, liver panel, calcium panel, parathyroid hormone, and vitamin D levels. Here are the general measures to reduce fracture risk. Do regular weight-bearing exercise such as walking, jumping, aerobics, line dancing, or Tai Chi. Aim for 1,000 to 1,200 milligrams of calcium intake per day from milk, cheese, yogurt, sardines, and Chinese greens. Exposure to sunshine for 15 to 30 minutes 3 to 4 times per week. Stop smoking. Reduce alcohol and follow fall reduction advice. The following are medications that may be prescribed for treatment of osteoporosis. This table helps to highlight the common health problems that are most prevalent among women at each life stage, and also provides guidance for the clinical approach to physical examination, laboratory testing, and immunizations. While these guidelines are quite comprehensive, professional judgment must be used for each individual patient. Thank you for watching this video. This video is presented by Yong Loo Lin School of Medicine's Department of Obstetrics and Gynecology. For more videos like this, head on to the National University of Singapore's website.